Hello everyone, my name is Martin Daro Garcia, and today I will be providing information on the hantavirus. So what exactly is the hantavirus? According to the CDC, the hantaviruses are a family of viruses spread mainly by rodents. In America, they're known as the New World Hantavirus and can cause hantavirus pulmonary syndrome or HPS. In Europe and Asia, they're known as Old World Hantavirus and can cause hemorrhagic fever with Raynaud syndrome. This virus is primarily spread through contact with saliva, urine, or feces of infected rodents. In the US, the most common hantavirus can cause HPS, is the sin nombre virus spread by the deer mouse. There are 4 kinds of rodents that are known to carry the hantavirus. And those are the cotton rat, the white-footed mouse, rice rat, and the deer mouse. Out of all those, only the deer mouse is found in the Washington state. So what are some possible risk factors? Those include living or working in areas with rodent infestations, coming into contact with rodent droppings or urine, and inhaling dust contaminated with the virus. So who is most susceptible to the hantavirus? Those are individuals that live or work in rural areas, campers, hikers, also pregnant women, individuals over 50, and those with compromised immune systems are all more susceptible to the severe illness. In our clinic, staff will work in areas that are not frequently occupied or clean, such as storage closets or sheds, may be at higher risk. So when is the infectious window and when are people contagious? After exposure, the incubation period can last anywhere from a few days to 6 weeks. People with hantavirus are most contagious in the early stages of the illness. Infected individuals may experience headaches, chills, dizziness, myalgia, which is pain in the muscle, fevers, vomiting, nausea, diarrhea, abdominal pain, hypotension, which is low blood pressure, and sudden onset of respiratory distress. And where should testing be done? If you or someone you know has symptoms of hantavirus, such as fever, muscle aches, and shortness of breath, contact your healthcare provider immediately. Inform your healthcare provider of possible deer mouse exposure so that he or she is alerted to the possibility of rodent-borne diseases, such as hantavirus pulmonary syndrome, or HPS. They will determine if testing is necessary and where it should be done. At the moment, there's no specific treatment, cure, or vaccine for HPS. If tested positive, patients are sent to the ICU, where they are intubated and given oxygen therapy to help them through the periods of severe respiratory distress if patient is experiencing severe symptoms. So why is this important to know for our staff, patients, and the community? So even though hantavirus is a rare disease, it can be deadly. As healthcare professionals, it's important that we understand the risk and take the steps to protect ourselves and our patients. Additionally, educating the community about hantavirus and how to prevent exposure can help reduce the risk of infection. So how can we protect ourselves, our staffs, and how are rooms to be sterilized? The best way to protect against hantavirus is to prevent exposure to infected rodents. If you're working in an area that may have rodents, take precautions and wear PPE, such as gloves, masks, protecting clothing, and use disinfectants to clean the area. If you suspect that you may have been exposed to hantavirus, seek medical attention immediately. It's important to remember that hantavirus is just one of many infectious diseases that we need to be aware of as healthcare professionals. Stay informed about emerging diseases and take the steps to protect yourselves and your patients. Thank you all. I hope this was informative. If you have any questions or concerns, please feel free to reach out. Thank you. Bye-bye.